Had was a 5 or 6 year old mixed breed dog. I think it was roughly about 50 pounds. And it presented because the owner had complaints of the dog having difficulty urinating. And also noticed that the urine had a red tinge to it, which kind of indicates to me that there was some bleeding involved. So we got the animal in, we did a regular physical exam. And on the physical exam, it was pretty much unremarkable. There wasn't anything abnormal that we saw in the exam. But we still knew that the animal had some difficulty urinating. So what we did, we walked outside and we collected some urine to do a urinalysis. And indeed, there was blood in the urine, as well as some bacteria. Once doing that, we went to the next phase, which would be to run some blood chemistry, to run some blood. On that, we noticed that we had a high white count, which indicated there's some kind of inflammation or infection going on somewhere. So the next thing we did was we took x-rays of that area. We know that we're dealing with the area of the urinary tract system, so we're dealing somewhere from the kidneys to the bladder to the ureter on outside. So we took an x-ray of that area, and on that x-ray we found what we were looking for.
Okay, let's see what you found on x-ray.
To give you some orientation on how we are here, these are the hind limbs, as if the animal is standing with his head facing to my left, okay? And this is the abdomen here. If we had more, the thorax would be up here with the heart and everything. So this area, the first thing you see that pops out at you is this area that looks very white.
Right.
When you're looking at an x-ray, the whiter the x-ray or the subject is, the more dense it is. That's why the bones are white. Then it grades on till it gets dark with just air, which is this black as air. So we see these little grainy little things here. That's the intestinal area and this gas in the intestine. But what are those white things? We look at those and we know right away that those are bladder stones. Dogs can commonly get bladder stones, and the way they get these bladder stones is there's a normal environment in the bladder. When that environment's become altered, it can be by what type of food they eat. It alters the pH of the urine. Once the pH of the urine is altered, it's an environment that can start developing crystals. Crystals are just microscopic things we see under the microscope, but once they clump and continue to grow, they get stones in the bladder.
Now, is this larger than you typically would see on presentation?
Larger, and the quantity is more. Normally, if you look in, you may see, and it's hard to tell now, but some of these little smaller stones. And you may see one of these larger stones here, but that would be it. So this was a very unusual case.
Right.
This was the largest quantity and the largest stone that I've taken out of an animal before.
And so the animal wasn't in any distress?
Well, I'm sure the animal was under some discomfort, you know, especially urinating. But if you think about the size of that, the stone quantity, it's encompassing the whole bladder. So when the dog did develop urine, it's basically just going straight out of the dog. There's no area for the urine to collect, which is normally what the bladder does. So he probably was had some incontinence where he was just kind of leaking urine. And the reason there's blood there is because these stones are just bumping around in that bladder, irritating the wall of the bladder and causing it to bleed some. Yes. Now, as far as what do we do once we see this? In this case, there's only one thing to do, which is surgery to remove them. But a lot of times there are smaller stones in there, or there are 1 or 2 stones in there, and we can treat them with diet. And basically what we do is we have to put them on a special prescription diet. And what that does is it alters the pH of the bladder back to a normal environment, and it dissolves those stones so that they can be passed out of the body.
So is it something that the owner did incorrectly as far as the diet of the pet that
Not really,
this,
not really. There's just some dogs that are predisposed to having them, and you really don't know what until you have them. You know, there's no prevention, like if you do this, you're not going to get them.
Right.
There are just some dogs or some breed that are predisposed to having them, and once we get problem with the urine and we detect them, then we just alter their diet at that point.
Okay.
Yes.
But you have some live stones that we can actually see today, actually.
Yes, we actually have the stones that we took out of this dog.
Oh, well, let's take a look at those.
The
It feels just like a rock.
Yeah, it feels just like when you grew up, you talked about the river rocks or the pet rocks.
That's what it feels like,
just like
actually.
that. But actually, it's a mineral deposit is what these are. And what we have to do, there are several different types of stones, struvite, and what we do is we send these in for analysis, and they tell us what type of stones they are, and that indicates or dictates what type food we put them on.
Well, viewers, I wish you could touch this. This is just like something you would see if you were walking along a stream and like a river rock, like he said. Really remarkable. So what's the recovery time for this after you remove something like this from an animal?
Pretty rapid. Usually after surgery, you know, we can remove the surgery last maybe an hour or so to remove them. And it's just like a basic surgery. After a week, getting the stitches out, they're fine.
Okay.
They have to have some relief right away. You can
Right.
think about taking those stones out of the bladder so they feel better right away.
Oh, wow. You know, as we were talking a little bit earlier, we talked about heartworms.
Yes.
And I know you have some heartworms in here, so
Yes.
are you going to show them to us today?
Sure, yeah. What we have is we have a heart that was
Oh,
removed
wow.
from a dog that actually had heartworms. And what it is I'm not sure if you can see, but you can see the stringy, those are the heartworms. And the heartworms reside in the heart of dogs that have heartworms. And now, when the mosquito bites them, he doesn't pick the worm up. He actually picks up a small microscopic larvae, or microfilaria that we call, and that's what he deposits in another dog when he bites them. Now, if the dog is on heartworm prevention, then it kills that right away. If not, it matures until it becomes an adult heartworm. And adult heartworm physically damages the heart. And they also cause problems with the heart as well as the lungs. They have respiratory problems. Usually one of the first signs that you'll see, the owner will come in and complain that the dog, it tires easier than it normally does. Where it used to run around, now it runs for a while, it lays down, it pants, it coughs. And then there are other signs that we see, and we can do a test. We basically take a blood sample and run a heartworm test, and within 5 to 10 minutes we'll know if it has heartworms or not.
So what's the prognosis if you find that there's an adult dog who has not been on preventative measures that you find out has heartworms? Can you treat that and it goes away, or?
We can treat it. The first thing we do is we have to grade it on a scale of 1 to 4. And what we're looking for is how much damage has been done to the heart and the lungs, and we do that by taking x-rays. We want to know physically if there's any damage to the liver, to the kidney, or any other organs, and we do that by running blood chemistry. Once we run those things along with the physical signs that it has, whether it's coughing, whether it has what we call exercise intolerance, it can't get around a lot, we grade them on a scale of 1 to 4. Once we grade them, it determines how we're going to do the treatment. In a normal treatment, in a dog that came in and we found heartworms, but it wasn't showing any signs, it will basically get a couple of injections 2 days apart. And that injection will actually kill the adult worms, okay? And then we start them on medication that will kill what we call the microfilaria, which are actually the immature ones that are in the bloodstream. After 3 or 4 months, we do a heartworm test, and usually they're negative. Then they get on heartworm prevention for the rest of their life, and they normally live a normal life. Now, on the other end of the spectrum, we get some in that have a higher grade that are already showing signs of heartworm. They may have enlarged heart or some other issues. Then we have to do some other precautionary things to try to increase their quality of life. Now, they can still have a normal life after doing treatment, but we get some in that have so much damage, so much heart damage and pulmonary damage, that we can't treat them. We more or less treat them symptomatically. We treat them for the cough, we treat them for the fluid buildup that they have, and we treat them for the cough and things of that nature, and try to get them to the point that we can treat them. But the life expectancy can be normal. It really depends on what the grade is.
So we've talked about a couple different things today, which has been, a lot of good information for the viewers. What are the more common things that you see come in to your facility on a daily basis? And also, in conjunction to that, what are some things that pet owners should look for as warning signs as far as some of those common conditions?
Probably in the South where we are, one of the most common things we see is itching dogs, okay, or itching cats. And basically, it's allergies, where when we have allergies, we sneeze, we have runny eyes. When dogs and cats have allergies, it manifests in skin problems. They're gonna itch. You're gonna have some of the small dogs that are gonna sit and just chew on their feet a lot, which we call atopy, which means that they're allergic to things that are in the environment, whether it's Bermuda grass, whether it's pollen from the pecan trees, the peach trees.
So they go through the same things we do, really?
Go through the same things we do. They're just manifest in a different way. Right. That's probably the most common thing we see. But we also see other things that are basically the same thing that we see in that human doctors see. We have animals come in that are diabetic. They have to be on insulin. We have to do curves and try to get them situated there. We have animals come in that have kidney issues. It's a big thing in these older animals. A lot of time, if the dogs and cats live long enough, they're going to either develop heart problems or they're going to develop some kidney issues. And there are some things that we can do to try to help those things. But mostly what we see, or what we would rather do, is be on the preventative side of the medicine. And that includes vaccinations, just routine baths and grooming and things of that nature, to try to prevent these things from happening before they happen.
Okay. We're back here with Coco, who's another patient of Dr. Ferguson. He's going to tell us why Coco's here, and tell us what kind of pet is Coco.
Coco is a Pomeranian, and Coco is here for one of our most common procedures, which is spaying, or ovariohysterectomy. And basically what we do is we remove the ovaries as well as the uterus, which is a little different in humans. They just do a hysterectomy, which is removing the uterus. We remove the ovaries and the uterus so that they can't have any puppies anymore. So that's what she's here for. So normally when we get them in, we do what we call just a basic health exam, just to look over to make sure they're fine for anesthesia.
Okay. So what are some of the common things that you would say as far as maintenance that pet owners should do?
One is we talked about earlier, which is food. You need to make sure that you're on a good premium dog food. A lot of the other dogs have other foods have a lot of fillers in it that aren't good for them. So make sure that if they're a puppy, they need to be on a puppy food. They're adult, they need to be on a good adult food. And if they're older, 7, 8 years old, they need to be on a senior diet.
What about grooming?
Grooming is very important. Depends on the animal. Some animals, like the Pomeranian, usually about once a month, they need to be combed out and they need a good bath and a grooming. Some of the larger dogs that are shorter hair, they may go a little longer, and it really depends on whether they're inside or outside or not.
Well, let me ask this question. I used to have a pet, and I had the most difficult time with house training.
Yes.
Do you recommend, there's a lot of literature out there where you can do it yourself, or there are programs that you can place the pet into actually to teach the pet?
Yeah, I think home, because you need to be in your own, the animal needs to be in its environment. And there are a lot of different ways that people try to train or teach them to do it. And I think the best way is what we call crate training, which is basically you're buying a kennel and the animal use the kennel as basically as a refuge. You know, it'll get to the point that it wants to be in the kennel, and you go from the kennel directly outside and just be repetitive with that, to be persistent, and they'll get it.
Now, if there are any of our viewers today who are interested in becoming a vet, what are some of your recommendations, or what things they should be thinking about at this point?
Some of the things, the first thing I would tell you to do is go to a veterinary hospital, volunteer. A lot of things look more glamorous on the outside than they are on the inside. So basically, once you do that and you really determine that's what you want to do before you invest a whole lot of time, but volunteer at a veterinary hospital. If you're in school, your sciences are very important. And the reason doing this, you need to do a lot of volunteering, because once you get ready to go to veterinary school, it's very competitive getting to veterinary school. And the more you can separate yourself from the next applicant, the better opportunity you'll have to get in.
Now, I know here you allow students to come in and do some internships here. Tell us a little bit about that before we go.
We're fortunate enough to be very close to Fort Valley State University in the veterinary science department. So we allow their students to come over and internship and employed here while they're in undergraduate. And from here, a lot of them have applied to veterinary school. I think we have probably 4 or 5 that are in veterinary school now that have worked either at the Critter Fixer here or the one in Byron. So we try to encourage all of them to not let this be a stop, to continue their profession.
So what's next on the horizon for Critter Fixer? I know you have 2 locations now. Is there a 3rd coming in the future?
I don't know. What we're going to try to do is just get better at what we do now, get better at our craft. And maybe at some time we'll employ some more veterinarians here and maybe even extend our hours. But we just want to provide a good service for the community here and try to get better.
Dr. Ferguson, we appreciate you joining us today on Perspective. You've given us some really good information. To the viewer, we hope you were educated on today and you came away from the show inspired as well. Listen, if you want to know more information about Critter Fixer, go to critterfixervet.com. Listen, followers, follow me on Facebook and on Twitter. Visit my website, perspectivestv.com. Tune in to us next week. You've been watching Perspectives, where you're not only informed, but inspired. Be blessed.